My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide and phentermine are two powerful medications often used in the treatment of obesity and weight management? Though they work through different mechanisms, their combined impact can significantly improve appetite regulation and satiety, leading to more sustained feelings of fullness, reduced caloric intake, and ultimately, weight loss. Here's a detailed look at how each medication contributes to the sensation of prolonged fullness, and why this synergy is effective in modern weight loss therapy. Semaglutide is a GLP-1 receptor agonist, short for glucagon-like peptide-1 receptor agonist. GLP-1 is a naturally occurring hormone released in the gut in response to food intake. It has several functions that are crucial for controlling blood sugar and influencing appetite. When administered as a medication, semaglutide mimics GLP-1 and significantly amplifies its natural effects. This includes semaglutide delays the rate at which food leaves the stomach and enters the small intestine. This slowed gastric emptying prolongs the physical sensation of fullness after eating. The stomach remains distended for a longer time, signaling the brain that food is still being processed, which decreases hunger between meals. Increased satiety signals in the brain. Semaglutide acts on appetite-regulating regions in the hypothalamus, especially the arcuate nucleus. It enhances satiety signals by activating neurons that suppress appetite and inhibiting those that stimulate it. As a result, patients feel satisfied with smaller portions and are less likely to experience cravings or emotional hunger. Ghrelin, often called the hunger hormone, is reduced when semaglutide is used. Lower ghrelin levels contribute to less frequent feelings of hunger, reinforcing longer intervals between meals and reduced snacking behavior. By slowing carbohydrate absorption and improving insulin sensitivity, semaglutide prevents the sharp blood sugar spikes and crashes that can trigger rebound hunger. This metabolic stability supports better appetite control and minimizes overeating episodes. Phentermine, targeting the central nervous system for appetite suppression. Phentermine is a sympathomimeticamin, meaning it stimulates the central nervous system in a way similar to amphetamines. It's primarily prescribed as an appetite suppressant and is commonly used for short-term weight loss therapy. Here's how it complements semaglutide. Phentermine increases the availability of norepinephrine and dopamine in the brain, particularly in regions responsible for controlling hunger. These neurotransmitters create a state of fight or flight, where physiological hunger is suppressed in favor of heightened alertness and reduced focus on food. Like semaglutide, phentermine targets the hypothalamus. However, it works by stimulating the lateral hypothalamus to reduce hunger signals and modulate reward-related eating behaviors. This makes it easier for patients to resist temptations and control impulsive eating habits. Phentermine also increases metabolic rate and energy expenditure, making patients feel more energetic and physically motivated. This helps reinforce behavior changes, such as increased activity levels, which further support appetite regulation and weight loss. Why patients feel fuller longer with semaglutide and phentermine together. The combined effect of semaglutide and phentermine creates a dual-action synergy that tackles hunger and satiety from both physiological and neurological angles. Semaglutide works in the gut and brain, providing a slow, steady feeling of fullness while regulating blood sugar and gastrointestinal function. Phentermine works in the brain, curbing the psychological and neurochemical drivers of hunger, especially in response to external cues and emotional triggers. Prolong the period during which patients feel full after eating. Reduce the urge to snack or eat between meals. Decrease portion sizes without feelings of deprivation. Improve consistency with low-calorie diets due to reduced hunger and cravings. In clinical trials, patients using semaglutide alone have achieved substantial weight loss, often 10 to 15% of their body weight. When paired with phentermine, under medical supervision, outcomes can be even more dramatic. Patients report, over time, these behavioral and physiological changes reshape the patient's relationship with food, making it easier to adopt sustainable eating habits that reinforce long-term weight management.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.